You've probably heard in recent years about the hype of infusion or IV therapy for things like hydration, fighting exhaustion, boosting your immune system, and getting vitamins into your system.
Welcome to Healthy Living, Wellness and Prevention, Medical Innovation, the Informed Side of Care. Welcome to Baptist HealthTalk.
Hi everyone, I'm your host, Joanna Gomez for today. And while the IV therapy market is expected to surge in demand and reach $4.5 billion by 2028, did you know infusion therapy is also a vital treatment for those battling all kinds of conditions? Here to tell us more about her experience as an infusion care therapy patient is Carolina Duran, along with Baptist Health Pharmacy Manager, Dr. Farima Ralph. Ladies, thank you so much for being here. Cannot wait to start this conversation with both of you. But before we do that, before we dive into today's subject, I want to remind all our viewers to send us your questions and your comments throughout this conversation. We are here for you and happy to answer any questions that you might have. So Carolina, I'm going to go ahead and start with you. You were diagnosed with anemia, which a lot of people can relate to, right? But then they said, hey, there are some ways that you can actually treat this. There is an infusion. How did you even hear about this? Who introduced you to this?
So after COVID, I had a flare-up of autoimmune issues. I think it's happening to a lot of people after COVID. And one of the side effects of with the autoimmune issue that I'm having is anemia and low ferritin levels, low iron. And my doctor recommended infusion because I did try the pills first, the I don't know what they're called, but the iron pills first. And it was hard to take, so he recommended the iron infusion therapy.
And how often do you take those?
So I do that about once a year.
Okay. Yeah. And can you tell the difference between like the iron pill and actually the infusion, that it's more tolerable?
It's more, yeah, absolutely. It's more tolerable, and it's a little bit, at least my experience, right? Mm-hmm. It's faster. I feel the effects faster.
Oh, that's good.
And it doesn't taste bad.
Yeah, because you get those after effects, right? Of sometimes when you take those pills. Is this something you are going to need for the rest of your life?
I hope not, but until I have everything under control, my levels, it's as needed, every 6 months or once a year. So it all depends on my levels, right?
Dr. Ralph, how do these actually work? We hear so much about this, but we actually needed you to explain to us, how does this work?
Of course. So infusion therapies work by delivering medication and fluid directly to the patient bloodstream. We can use them to treat a variety of conditions, neurology disorders, infections, autoimmune diseases, and even as supportive care to help the patient with dehydration, any vitamin deficiency, and to treat pain.
Okay, are there more benefits or any benefits from IV therapy? Now, I obviously don't want to sit here and compare because they're both obviously very good, but what are the benefits?
Okay, so from the clinician standpoint, I think efficacy and onset of action is really important in a specific condition. Generally speaking, IV therapy delivers the medication to the bloodstream of the patient. So the patient will experience relief faster, especially if we are looking at treating symptoms and we are looking at symptom management. Convenience for the patient is another factor. Some of this IV therapy treats the patient and gives the patient 3 or 4 months, as Carolina also mentioned, up to a year gap before they need another treatment. So the times between treatment definitely is a time-saving factor and a convenient factor for the patient.
So pardon me if I am not understanding you correctly, but does it mean that you can actually hold off a little longer? Like it stays in your system longer?
Yes.
How is that? Is it just because it directly hits you where it's supposed to, or go where it's supposed to? How does that work?
So those are great questions, and it all depends on which treatment we are talking about and what condition. For some treatments, the amount of medication that you are getting to the patient's bloodstream, the dose is a little higher, and it's directly going to the organ that we want it to go through the bloodstream. Mm-hmm. So maybe one dose every 3 months, every 6 months, or maybe once a year is more than enough for those patients. But there are also infusions that the patient needs to get them maybe every week, or maybe 3 or 4 doses per year, back to back, but then they are good for a year.
Have you seen that you feel better faster and that it's just easier for you quality life?
Absolutely. I mean, I think I felt faster, and it was easier, less symptomatic because of the iron pills, right? They always have that taste, the other side effects. I'm sure the iron has its own side effects because they did give me Benadryl right before I took the infusion. The nurse was great. I waited there to make sure that I had no symptoms, but I just felt better faster. And to the doctor's point, I only need it either every 6 months or once a year, depending on my levels. So I get my levels checked every 3 months.
Okay, so I have walked around malls, airports, you've named it, you've probably as well. Social media has really taken a liking to IV therapies. I am so confused, and I think probably at home so many people are also confused because is it a trendy infusion recommendation? It is a medical. Can you break that down for us, please?
Absolutely, and that's a wonderful question. We have seen a lot of trendy infusion advertisement in the community, and patients usually ask about that. They want to know more. They want to know how to pick the right site of care for themselves. Yeah. So in general, we have two category of infusion. One of them are to treat medical conditions such as autoimmune disease, neurology disorder, GI issues, rare diseases, genetic diseases, cancer, through IV therapy. And then we have the other category that they are almost considered supportive therapy, hydration, cocktail bags, banana bags.
I have seen even to glow and make your skin look better. I have seen it all when it comes to these. Are these factual things? How does this work?
Absolutely, absolutely. So that's the second category that we are seeing more in the community. Yes. Maybe in the airports, in some of the salons, communities, or even independent infusion centers that they would like, to provide that service for the community. And to answer your question, those are available. Yes, we hear about them, and they are effective. But when patients are going through selection of the site of care for themselves, we really want them to keep two things in mind.
Okay.
Which are very important.
Go ahead.
So first and foremost, even though these treatments and these therapies are considered supportive care, but they are not one size fits all. They are still considered treatment, and they can change how your body functions, even if it's just fluid. An example of it would be a patient with heart failure. If the patient is dehydrated and they need volume and they need fluid, that needs to be really controlled and managed by a healthcare provider that knows their condition and also how much fluid they are going to receive. So we highly recommend the patient to make sure that if they are receiving those supportive infusion, they know this is for their need, this is appropriate for their body, their lab values, and it's under supervision of a healthcare provider that is highly trained in the field. The second thing that we want everybody to be aware of, where and how you are receiving this infusion.
Yes, very important.
The quality of active ingredient and the origin of active ingredient and the medication that we put in our body matters. Also, the technique that we prepare, compound, and deliver this medication matters. Individuals that they are able to provide you with an infusion, it starts with an injection. It starts with a needle going through your body, your bloodstream, and delivering a medication. So it's really important to consider those factors when you are picking a site of care for those supportive infusion.
You just mentioned very serious issues that people might be, conditions that they may be dealing with. Cancer, multiple sclerosis, the list goes on and on, that they need these therapies in order to live a healthy life. Does this kind of supplement, or does this replace something that what they're taking? How does that work?
So it all depends.
Okay. So
and it depends exactly on the condition. Yes.
Everyone's different, correct?
It depends on the condition. For a specific condition, we usually start the patient maybe on an oral therapy. As Carolina was mentioning, let's say for a patient with anemia, usually depending on their labs and the symptoms, how they are feeling about their condition, the provider might decide to start them on iron pills and then reevaluate. Is the patient tolerating it well? Are they getting the result that they want? Are their symptoms getting better? And if not, then they can transition the patient to IV therapy, which is IV infusion that we are providing. In other conditions, the patient might giving us some response and improving on oral therapy, but it's not where we want them to be. So we add the IV therapy to their current regimen to optimize the entire plan of care for them.
Have you seen that there has been an uptick with this, that people are actually more interested in IV therapies? And because I feel like it's fairly new, in the medical world, but it probably is not, and it's just kind of catching steam.
Absolutely. So we have seen a lot of public information about it. Social media has been a contributing factor. And the overall society, I think we are moving towards having healthier lifestyles. And we want to take advantage of everything that is available to us and potentially can make us feel better and have a better quality of life. So I think definitely the community education and all that exposure has helped. I do see patients being more open to the option of have IV therapy, especially after we educate them and we talk to them and tell them about the benefits and the potential that there are in these therapies.
And probably a huge uptick, right, when it comes to after COVID, because I think during that moment we were all living so scared and no one wanted to get sick. And I think that's probably where a lot of it started. Carolina, I'm curious as to what you would want people to know if someone is watching right now and they're saying, I'm interested in doing something like this. What is something that you would say to them?
I definitely encourage you to, number one, work with your provider. Ask your provider, is this a choice? If you've tried medicine, if you've tried pills, just say, hey, and it's not working, ask the provider for another alternative treatment. I would say work really, to the doctor's point, work really closely with the provider. I think before I saw my doctor, I was feeling tired and sick, and I knew that my autoimmune had been flared up thanks to lupus. Thanks to COVID. And I just tried to go get some vitamin infusions because I thought this would be feel better. And of course, yes, the vitamin B12, the vitamin C was great, but it didn't really trigger, or it didn't really help what I needed with the low ferritin levels, with the low iron levels. So really is working with that provider and asking them what's the right treatment for me, what's the right information. So that's what I would tell the patients.
You would highly recommend it then?
I would absolutely highly recommend it.
But obviously speaking to your doctor is more important than having a routine. As you guys can imagine, the internet has a lot of theories about IV therapy. And we went ahead and we did some research and found the top most research questions on the internet. And we would like you to debunk them if they are not true and kind of help us get through this. So the first question is, are infusion therapies affordable?
Absolutely. So majority of the health plan and insurances that the patient hold cover for injections and infusion therapy. Again, it depends on the plan, it depends on the treatment, but a process that we have in place is that we contact the insurance company after we receive a patient referral to first make sure the insurance company is authorizing the treatment for the patient. We calculate an estimate for the patient responsibility, and we do share that estimate in advance with the patient to make sure they are comfortable with it. If they are not comfortable with their patient responsibility, or if they have any difficulty that they are experiencing at that time frame financially, there are options and there are resources that we can access. There are foundation funds available, there are medication assistance programs that they are available, and ultimately we can consider payment plans for the patient to make sure the financial is not something that stands between them and the therapy that they need. Patient care is truly at the center for us. So we do everything possible to make sure the patient receives their treatment.
Absolutely. I agree with you. And I think everyone that's watching right now is probably very happy to hear what you just said. Here's another question that we found that came up. What are some issues that come up with IV therapy? We spoke obviously about a lot of the benefits, but there obviously must be some.
Absolutely. There are a few that we can talk about. So the first one is allergies. Human body. We put anything in our body that is a foreign substance, whether it's a food that we haven't tried before, if it's a pill, oral medication, or injection, our body can react to it and show an allergic reaction. So Carol also mentioned about this. For some medication, the chances that you might have a reaction is a little higher than the other medication. Therefore, for those medications, we always collaborate with your provider and make sure that we pre-medicate you in advance. Also, if you're experiencing any reaction after the infusion, our staff are highly trained. Again, another reason that we need to consider what is the site of care that is providing treatment for us. You want a staff that they are highly trained and they are healthcare providers that they can take care of you in case you experience a severe allergic reaction. In that case, we can also manage the patient. And clinical pharmacies are usually available to collaborate with your provider and make sure that they are creating a new plan for you if, the first medication that you had, you didn't react too well to it. So there are always alternate options that we can, create a plan and put together.
I obviously know that you cannot speak for every physician that is out there, but that you have seen, that you have experienced, are majority of physicians pretty much open to IV therapy and to giving it to their patients?
Absolutely, absolutely. So our physicians have been very open to collaboration and be able to provide those infusion treatments. They are very familiar with our protocols and the referral sources. So it has been a great partnership. This is something that truly is beneficial to our patients and the care that they need.
Yeah. Okay, so another question that we found on the internet, one of the top most researched questions, is there infusion therapy for migraines?
Yes.
There is. And by the way, migraines can be debilitating for some people, cannot even get up, go to work, and live a happy life.
Absolutely.
So this is a plus to hear.
Yes. So, Joanna, this is a very exciting time in the world of infusion. We are seeing a lot of new therapies are coming to the market for different disease states. And of course, one of them, migraine, we do have therapies now that the patient can receive a dose, come to the infusion center, stay with us for 30 minutes to an hour, receive a dose, and they are good to go for about 3 to 4 months. It helps with migraine prevention. Specifically, this is not, again, for every patient. We need to collaborate with your providers, but options are available.
Okay, that really is probably a big sigh of relief for so many people that suffer with migraines. You've obviously been doing your research on this. You are the perfect person to ask, is there going to be a drastic uptick with people using infusions more when it comes to other things that we might not know at this moment that will actually help?
I do believe yes.
Yes, you have seen it?
So again, it's very exciting. We do have a lot of agents in the pipeline. There are so much research and studies that they are coming out and showing there are new treatments available for rare disease, genetic disease, and other conditions that we might not have a gold standard for the treatment yet. So that's an exciting time, and I look forward to learning about all of those as well.
Yeah, I mean, I think this is a learning process for so many of us. Before I let you go, I would love your takeaway when it comes to what you would want people at home to know when it comes to IV therapies. I'm going to go ahead and start with you, Carolina. As a patient, what you would want people to know?
I think I would want people to know that there's alternative treatments to our regular, pills that we take, not because they're less efficient. It's just maybe it's your convenience level, maybe it's your preference level. And so ask your doctor. There's new drugs that I didn't even know could be infused after I had my iron. And it's really interesting to, as a patient, take control of your care, become educated, and speak to your provider, because it might be that your provider just thinks, oh, you prefer pills. And it's, so I think it's important to speak to your provider and do the education and become an educated patient.
And might I just add that, as a patient, right, I'm sitting here thinking, well, maybe there is something that you can help me with that I am suffering with that could make my life a little bit easier, and I don't have to take a medication every week or every day. So that is also a plus.
Yeah, absolutely. So I think I want the patient to know that IV therapies are available, they are safe, they are effective, and they are affordable. But I do want patients to advocate for themselves, ask the right question from their provider, make sure that they have the best treatment on file and on plan of care for themselves. And when it comes to selecting the infusion site or an infusion centers, go and take a look at the infusion center first before you receive your therapy. It is okay to request a tour of the infusion center to see the staff, make sure they have the qualification, they have the right training, and they can take care of you. That's what I would do for my own infusion needs.
Great tips, advice. Ladies, thank you so much for such a wonderful conversation. I wish you both the best of luck. Thank you for sharing this insight with our audience. And remember, viewers, be sure to hit that subscribe button on your channel here to keep up with the latest health and wellness information and tips from our experts. Thank you so much for watching, and be safe.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.